Hi, I'm Rick Walters with Fort Wayne's Smallest Winner. Today we're here with Andreas Lohmar, physical therapist and owner of Summit Physical Therapy. Today we're going to discuss an issue that Patrick developed during our program as a contestant. So what exactly happened to Patrick?
Well, Patrick developed a problem that I've seen with so many other contestants throughout the program. He essentially compensated for his excessive weight bearing over time, which forced him to be in a position of spinal flexion, which then caused his hips to not really straighten out, and the same thing happened to his knees as well. So it necessitated compensatory movement, which we had to address.
So what kind of problems did bending at the hips and the knees cause Patrick?
Well, it really all started when Patrick stopped extending his hips and his knees to full range of motion. So over time, his hip flexors became tight, the joint capsule and the back of his knees became tight as well. I often refer to this posture as like the invisible cast, similarly to having your elbow in a cast for 6 weeks at a time. When that cast comes off, you wouldn't expect to all of a sudden move your elbow to full range of motion.
Sure.
The same thing happens to other joints in our body, as well as segmental joints in the spine itself also.
So Andreas, how do we go about restoring normal motion to these joints?
Well, first of all, Rick, the patient has to have a really good understanding about the implications of these motion deficits and these postural changes. So we're not just talking about tight hamstrings here, we're talking about limitations in the joint itself, where we're not just stretching muscles anymore, we're actually stretching connective tissue, which takes much longer and oftentimes will, particularly in Patrick's case here, will extend beyond the actual duration of this contest.
How long will it take to return Patrick to normal joint mobility?
Well, in Patrick's case, I would say it would take him about 2 to 3 months. That is assuming that there's really no underlying structural problem with the joints themselves. So in essence, this is not something I can fix myself. It really requires the participation on Patrick's part. So there's a large home exercise program that he has to follow through with.
Thanks, Andreas. That's some great stuff. Follow along at FortWayneSmallestWinner.com.